And what a great announcement, and again it shows the investments that the Albanese government's been putting into Medicare are making a real difference on the ground. So fantastic to hear that you're in a position to do that, to be 100% bulk billing. That's exactly the aim of the policy that the Prime Minister announced in the lead up to the budget. When we came to government, Medicare was on its knees. It had suffered a decade of neglect. It had had 6 years of MBS indexation freezes. And because of that, it meant people were paying more to access their health care. Now, the Prime Minister and Minister Butler have started to turn that about in the first 3 years with new models of care like this, Medicare urgent care centres, which are so popular, and meeting that need, taking pressure off emergency departments, and is a real contrast between the government that we are and the opposition leader and his future commitments around health. What you see is us trying to strengthen Medicare, build it back, make sure people do only need their Medicare card when they access primary health care, and Peter Dutton, who's going to cut. And we know he has to cut because, and they're making those announcements, maybe saying it out the silent bit out loud, as the PM said. We just saw overnight Sarah Henderson saying that fee-free TAFE is gone. Under them in Tasmania, 6,500 students have enrolled in fee-free TAFE, making a difference, skilling up the next generation of workers. Well, that's going to be cut. That's clear. That was announced yesterday. But we also know he's going to have to cut. He's going to have to cut the public service. Wants to abolish the Department of Health, which actually runs Medicare. We're going to have the Doge-style cuts being taken right through the public service. Senator Nampijinpa-Price confirmed that on the weekend. And we know all these cuts are coming. He's actually confirmed these cuts are coming. He's just not going to tell you where they're going to happen till after the election. And he has to do it because he has to pay for his nuclear reactor scheme. $600 billion he has to find through services like this. And the fact that the local candidate here couldn't confirm that this would be bulk billing service under a Peter Dutton government, I think says everything. We know that these are the services at risk, the people in the waiting room who are about to be seen and only use their Medicare card. That is what's at risk through this election campaign.